Hi everyone, today I'm going to share an example of using ClinicalKey to analyze a case from emergency department. This is a 40-year-old female with a past medical history of hypertension and bipolar disorder. She presented with a severe epigastric abdominal pain for a few hours. The pain radiated to the back and accompanied with nausea and vomiting. The patient denied any history of consuming alcohol or illegal drug abuse. Recently, she didn't start any new medication, and there was no history of abdominal trauma. She had a cholecystectomy in 2004, and here are some questions raised from this case that can help us clear out the clues. Let's go through the questions. First of all, the main complaint of this patient now is a epigastric abdominal pain, so it is crucial to know which organs are covered in the upper abdomen. And this basic question may lead us to the possible cause of abdominal pain of this patient. And beyond that, you should also acknowledge different causes of the pain from different locations of the abdomen. To find the answer of these two questions, you can approach to a related information from the website www.clinicalkey.com. Input the keyword upper abdomen and click search. Here we can see thousands of results related to upper abdomen come out. To narrow down the results, we can choose the source type from the left column. As we're searching for medical facts on upper abdomen, we assume that the answer could lie on books that related to anatomy or internal medicine. So here we can simply select the source type books. As we can see, several chapters were screened out. You can rank the results by relevance so that the outcomes could be more fit to the questions. Here we find out a chapter about gastroenterology from the book Community Pharmacy. In this chapter, a beautiful illustration about the structures located in different quadrants of abdomen were reviewed. From this illustration, we've learned that it might be more informational if the patient could point out which quadrant was hurt, because different conditions could be considered. In ClinicalKey, you are able to bookmark, save, email, or print the pictures, which is very convenient in your daily work or study. Now, let's get back to our case. What is the possible diagnosis of this case? ClinicalKey provides strong selecting strategy based on authentic medical contents and high-level tagging technology. This strategy can help us with the diagnosis and differential diagnosis in many medical things. Here, we present you the basic procedures using ClinicalKey to assist diagnosing in this case. First of all, you should extract proper search terms. You could summarize from the main complaints and several important associated symptoms, like in this case, sudden severe epigastric abdominal pain, nausea, and vomiting. Some characteristics of the symptoms are specific to some diseases, so it is also important to include these characteristics, like the pain radiates to the back. Sometimes the medical history are important, while others are less. You should estimate the level of importance of different indexes and sequence them from the most important one to the less ones, and leave out the confounding factors. Next, you could try your search indexes in ClinicalKey and find the probable diseases. Simply input the search indexes and click the button Search. As usual, all source types were searched. The next step for you is to narrow down the results. As we encountered in this case in the emergency department, and we are simply requesting a possible cause of this case, we could choose clinical overview and emergency to find out what could come out. Here, two diseases were screened out: cholecystitis and acute pancreatitis. Following, remember always to compare with your own case. The results could only provide you a recommendation. The final decision is on you. As we mentioned, the patient in this case had a cholecystectomy in 2004. Thus, we might consider acute pancreatitis in this case, but more tests should be carried out to confirm this diagnosis. The next step is to add additional examinations according to the diagnostic criteria. In this case, the patient has already done some physical and laboratory tests. Through a physical examination, the patient was epiphral, had a heart rate of 105 beats per minute, and a blood pressure of 132/84 mm of mercury. She was in severe distress due to the pain with severe epigastric tenderness. The remainder of her physical exam was normal. Her laboratory tests on admission revealed an elevation of WBC and neutrophils, and a decreased potassium level. The serum amylase and lipase showed normal value. Since the patient was in severe pain with no clear diagnosis, a CT scan of her abdomen with intravenous contrast was done in the emergency room. The CT scan showed fast straining in the pancreatic head, consistent with pancreatitis and active thickening in the duodenum. The next thing we have to consider is the following steps of the test to further confirm the diagnosis. We could easily find the concise and comprehensive knowledge of a disease in clinical overview by clicking the disease. You could quickly review the synopsis of the disease, including its key points, pitfalls, and terminologies. The orange model will present if the disease might require you an urgent action to save you time of making quick decision. If you want to go through clinical presentation examinations, you could click on the terms you want to review. Then it will skip to the page on which the content you want to go through. Check up the tests that can supplementally help you make the final diagnosis. Remember, not all lists of examinations should be performed. Always pick the ones that help you in your own case. You can consult the sensitivity and specificity of an index listed in here and weigh every test specifically to your own case. After accomplishing necessary tests, you could finally make the right diagnosis based on the results you've obtained. Primary diagnostic tools or diagnostic algorithms can be found in clinical overview. You should compare the results with the diagnostic criteria. Like in this case, the patient appeared to accord with at least 2 of the following criteria of acute pancreatitis, including characteristic abdominal pain and confirmatory findings from the CT scan. In addition, it is important to figure out the type and phase of the disease so that proper clinical management can be carried out to avoid medical negligence or excessive treatment. Thus, you can also check these vital information from clinical overview. In this case, the patient might be related to systemic inflammatory response syndrome, since she seemed to accord with 2 criteria that suggest the syndrome, including a pulse more than 90 beats per minute and rise in WBC count. Rigorous observation is needed to monitor if these presentations keep showing. The persistence of systemic inflammatory response syndrome for 48 hours suggests multi-organ failure, which predicts poorer prognosis, and this patient meet criteria for ICU admission. As for the treatment of the disease, ClinicalKey supports from different angles and multiple materials. You can find the recommendations for specialist referrals in clinical overview. The main goals of the treatment, the guidelines or references, the professional recommendations based on are listed clearly and easy to trace. If you want to go through the full text of the guidelines, you can screen the information by selecting guidelines and access different versions by clicking on the colored full text icon. Download the ones that meet your needs. Learn from different practice guidelines so that we can gain stereoscopic recognition of clinical management In this case, for example, we should be alert when clinical conditions deteriorate with or without imaging funding support for infected pancreatic necrosis, i.e. IPN, might happen. If the risk factor for infected pancreatic necrosis were evaluated before IPN happened, we could be more prepared to avoid this and lower the mortality of acute pancreatitis to a great extent. Thus, it is crucial to assess the risk factors of IPN beforehand. Out of this consideration, we could search clinical trials that focus on the risk factors of IPN and ClinicalKey. Similarly, we search infected pancreatic necrosis in clinical trials, and full text of the articles can be accessed. Some trials have already been finished, and several articles are published. We could read the results directly in the full text. Whereas the other clinical trials might not be finished, or although completed but without publications, we could easily look up the status of a trial in ClinicalKey, checking the study type, the sample size, the criteria, or the foundation of a trial. When you are valuing which drug might be more suitable for your case, you could use the clinical comparison report tool to compare the indications, contraindications, and reverse reactions between different drugs. Pick the items that you want to compare. In this case, in order to relieve the severe abdominal pain, you may want to value the side effect of opiates or acetaminophen in the symptoms of depression, considering the bipolar disorder history in this case. The overall adverse reactions can be compared in adverse reaction reports. Similarly, you just find the drugs you want to compare and hit the Run Report button. Some cases might require clinical operations, thus the standardized procedures should be known well. ClinicalKey provides thousands of videos involving surgeries and procedures you could learn from. Beautiful medical illustrations were collected in another series of books to teach you surgical approaches to pancreas in this case. Finally, it is also vital to keep your patient informed. ClinicalKey provides you with adequate patient educational materials. For example, you can search acute pancreatitis in patient education type. Select the language you wanted to print. Add your contact information and special advice for your patient, and create a printable PDF to generate an exclusive version of your own patient education material. This is the all information I want to share with you regarding today's case. I hope this will help you use ClinicalKey successfully in your own case. Thank you very much.